And I can't hide. These growing pains are keeping me up at night.
The information that we share today is from our own personal experiences and does not constitute medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suitable for you or your condition. Please consult with your physician if you have medical questions as it may pertain to your condition.
Hi everyone, welcome back to Take a Paycheck. This week's episode, I'm so excited to introduce our guest, Katie Spilka. So Katie is a registered nurse in Cleveland, Ohio. She went to Kent State University and obtained a Bachelor's of Science in Nursing, and she's currently working for University Hospitals. Hi Katie, I'm really happy to have you on today. Can you start off by introducing yourself and your diagnosis?
Hi, I'm Katie. I was diagnosed with Raynaud's and scleroderma when I was 16. I'm now 26, so I've been doing this for a while. So I was first diagnosed with Raynaud's, and what Raynaud's is, it affects your circulation as to where in your fingers and your toes you have little capillaries, and that's how blood is supplied to your extremities. And in the case when you have Raynaud's, I had a doctor explain it to me as to where your capillaries look like a little picket fence. And when you have Raynaud's, the capillaries start to turn into squiggly lines as opposed to nice straight lines. And eventually they drop off as you get further damage. And this can be from cold, from stress, anything that would cause your body to start to constrict, and you just don't get the circulation and the blood flow. And then from there, I had been diagnosed with scleroderma. So I would say the vast majority of people with scleroderma have Raynaud's, but not everyone who has Raynaud's has scleroderma. So that kind of helped in my diagnosis of scleroderma too. So I was diagnosed with Raynaud's, maybe I was 15, and then I was diagnosed with scleroderma probably about a year later when I was 16. And scleroderma is an autoimmune disease. The origin of the word technically means hard skin. And it's basically when your body produces an excessive amount of collagen, and that can build up in different areas. A lot of people, I want to say probably everyone with scleroderma, it starts in their skin and it can progress to your internal organs and other places in your body, causing them to be hard, essentially.
Wow. So specifically for you, because you do have both of these conditions, where does it kind of affect you? I know you mentioned skin and then fingers and feet, but are those the exact places where these conditions affect, or are there other places in your body?
So as far as the Raynaud's go, I would say definitely in my hands and my feet, it bothers me. I know some people get it bad, on their ears and on their nose really bad. But I personally get it in my hands and my feet. Anytime I'm in a stressful situation, I can tell that I start to lose circulation. My hands get really spotty in color and they turn totally white. And then you can see as to other parts on my hand where I do have color. So it's white and then red on a different part of my hands. Or if anytime I'm in a stressful situation that will happen too. I used to tell my mom when I was younger, prior to getting diagnosed, when we walk through the freezer section of the grocery store, be like, Mom, my hands and feet are numb. And she's like, you're dramatic. It's fine. But that was my Raynaud's at the time. And then as far as scleroderma goes affecting me, so initially something that I had esophageal dysfunction. I would feel like things were getting stuck in my throat when I was trying to swallow. Another big thing was the skin on my hands was really tight. So the average person is able to close their hands together like this, palm to palm flat. And when I was initially diagnosed, I was able to do this. My fingers would not straighten all the way. The skin between my knuckles, on a normal person, you should be able to grab some skin that was so tight that you really couldn't pull anything. And then I did have a lot of arthritis symptoms in my hands as well. And a combination of the skin thing and just the way like my joints on my hands looked was kind of what led the rheumatologist I was seeing to come up with this diagnosis. And then the other things kind of fell into place, like, oh, it makes sense that you're experiencing those things, like the swallowing thing. After she kind of came to the conclusion based on basically my hands was like the huge thing for her.
How long did it take to get diagnosed?
As far as the Raynaud's goes, which I guess started like my whole scleroderma thing, I started having symptoms. I was young. Honestly, I don't even know. It was well before I was 15. And so a little bit of a backstory. My mom has like Raynaud's, undifferentiated connective tissue. She has like a whole slew of like autoimmune issues. So she was like very familiar with what I was explaining to her. And I just went to like an yearly physical with my pediatrician, and she blew me off and told me I was being dramatic and that I was just cold and there was nothing wrong with me and that people at my age don't get this. So we kind of blew it off. And then eventually my mom had made me an appointment to see a pediatric rheumatologist, just because she saw a rheumatologist for all of her issues. And she was like, I really don't think something's right. So after going to that appointment, then the rheumatologist I saw was like, yeah, you definitely have Raynaud's, started me on amlodipine to help with that, just because the point of that being as a blood pressure medication, but when you take it, it helps dilate your capillaries, which on top of decreasing blood pressure will also increase circulation to your extremities. So she started me on that. And then I was following up with her like every 6 months or so. And it was like maybe 2 appointments after when she was doing my exam. And like when you go see a rheumatologist, they're checking out every single joint on you, bending it, looking at everything. And when she got to my hands, when they do the whole like, oh, squeeze my fingers, whatever, my grip was horrible. My joints, I have like arthritic looking joints on my hands too, which is relative to, I guess, the type of scleroderma I have. And then the tightness of my skin. So from there, I was actually sent to Pittsburgh Children's to see a pediatric rheumatologist there because they have a scleroderma clinic. So I actually went there, and that's where I received like my official diagnosis.
Oh my, okay. I think sometimes the details of like what happened make it sound like it was longer than it actually is, right? Because you're telling me this, and I'm just like, this sounds like it probably took maybe like 4 years, but it didn't, which is great because I think it's really important to kind of get your diagnosis as soon as possible, but also get the most accurate diagnosis rather than be misdiagnosed.
Mm-hmm.
I'm glad that your process went pretty well. Would you say that it's diagnosed based on like blood markers, but also like, I know at the rheumatologist, like they kind of like test your joints and see what happens. Do you think those are like the main ways it's diagnosed, or are there any other ways?
So I never actually got like an ANA or blood work done. So I was diagnosed solely on like my presentation of symptoms. And then when I went to Pittsburgh Children's, the doctor that I saw did a bunch of research. And so she put me in a research study, which I guess this was the only blood work that pointed me towards scleroderma, where she was looking for antibodies, and she had taken different antibodies and figured out that like these people, this is what like system it affects, or this is the extent of your disease kind of. And it's not like 100% accurate, and it's the research that she personally does. But what she found with mine was that I had antibodies similar to these other people, where it mainly affected their joints and they had a lot of arthritis symptoms. So that was, I guess that was another like confirmation blood test, just because I ended up having what these other people had too.
I think sometimes people, like for me, it was based on blood tests, mainly to confirm it. But I think most of the time it's kind of like a combination or like one or the other, just to kind of figure that out. And you also mentioned that a lot of the time, well, some people were saying that like it wasn't real per se, or you were kind of making things up. How did it feel when kind of the adults in the room didn't believe what you were experiencing?
It was terrible because I lived at home with a mom who had all of these issues. So I felt like I wasn't crazy. Like I had seen this on somebody else, and I'm like, wait, this is happening to me. And I was very, very lucky that my mom advocated for me because she knew what she was talking about also from her own experiences. So I was lucky enough that the people who weren't listening to me was my pediatrician, and it wasn't like my parents, because then my parents really kept pushing for me. But going to see my pediatrician over it was super frustrating because I'm telling her that all of these things are wrong, and you should feel like you can go to your physician and say, hey, this is what I'm experiencing. Please help me. And when you're going to someone asking for help and you're not getting anything other than you're dramatic, you're making it up, that doesn't make you feel too great, obviously.
It doesn't, and I understand that. I mean, I didn't experience that when I was diagnosed with arthritis, but I do understand how that would feel when people are kind of saying, like, no, you're making it up, you're so dramatic. I didn't experience that with a doctor, but I kind of experienced that in like the school setting. So along those lines, you were kind of 15, 16 when this happened, and you're in high school. What was kind of going through your mind at the time in high school? How did you cope? How did your friends and family react to your diagnosis?
So my family was awesome. Like I said, a lot of it being because my mom had experienced these things before. As far as like friends go, my friends were supportive, but it's also hard when you're that age. And I guess at 16, did I really have the capacity to process everything that was going on? Probably not. And if I didn't, then my friends who know nothing about it absolutely did not. So while they understood that, like, hey, there's something wrong with me, I don't think that they understood like to the extent of how serious it was. And then I was just kind of trying to like play it off, make a joke about it because it was obviously uncomfortable.
Yeah.
But my family was amazing and supportive. And my friends were as supportive as they can be at that age.
In terms of support, even just like talking to them about it, even if they don't understand and they're still listening and kind of like saying something or sometimes not even saying anything, it's like even that little amount of support can make a difference. Like they don't need to fully be like, okay, I understand all of these terms. What other resources did you use to gain support? Because I know I actually went on Google and I found like support groups and stuff.
So initially, I honestly didn't do too much. I asked Dr. Google a lot of questions, and all that did was freak me out.
Yep.
The only like scleroderma event I went to, my parents took me to this thing. I don't even remember what it was, but it was a whole day, and there were a ton of different physicians there talking on all of these different topics. There was like a dermatologist there, a rheumatologist, a pulmonologist. And all I took out of that day was I was scared to death when I left, because I guess you saw all these people who were like worst case scenario. And that's what these physicians were talking about too. So I was like very newly diagnosed, just starting all of my meds. And I go and I'm sitting through this talk where they're talking about, oh, pulmonary hypertension and pulmonary fibrosis. And, you know, if you get this, your 5-year life expectancy or your chances of making it past 5 years are like 20%. And I'm leaving this thing like, Mom and Dad, why did you take me to this? Like, it caused me to totally freak out and panic. And after that, I guess, didn't really want to be involved as much with like the scleroderma community because I was so freaked out after that. So I really wasn't doing well for a while. And more recently, I've like reached out to other people who have it and have chatted with them a bit. And that's been super helpful. The powers of social media. I've met a lot of people on social media who also have scleroderma because it's so rare in people, even like my age now. So at that age, when I was diagnosed, I wasn't meeting other people who had it, who are my age. They were like in their 30s, 40s, 50s. So now I've met some people and it's been nice to actually talk about it.
And like, it definitely does freak you out at that age. Like, I think as we grow older, we realize that social media and the community that's out there for chronic illnesses and like rheumatic disease is so big. So
yeah, definitely. There's a whole nother world out there.
And I'm so glad that you were able to now find people that you can talk to about your condition, because I know that it is rare. And even for juvenile arthritis and specifically like JIA, it is rare, but I mean, like, you tend to find so many people, and then you're like, is this actually rare? It still is, because like in your bubble, there are so many people, but it's still a rare condition. It's so important that many people are aware of what it is.
Yeah, definitely.
How does your condition kind of affect you on a daily basis, and like some of the things that you do? Because I know that you're a nurse, and I know that you have things going on a daily basis. So how does scleroderma and Raynaud's kind of affect what you do?
So I would say it definitely, when I was in the midst of being my sickest, it affected me a lot more. My joints were a lot worse. I had horrific grip strength. My joints were much more swollen, like my skin was tight. So working with my hands a lot really bothered me. And especially like when I was in high school at the time, I was like on my high school's dance team, and we'd be performing outside in the cold, and I'd be like, my hands are numb. I literally can't feel them. And I would be in so much pain afterwards. I would be numb for an hour. And it really did affect my quality of life. Now, fast forward after all of my treatments and being in remission, it doesn't affect me as much. Like my grip strength still isn't incredible. If I'm doing something with my hands for long enough, I can definitely feel like my joints are starting to get like achy and sore and a little tight, but I wouldn't say now it affects me as much, and I notice it as much. And the Raynaud's really only bothers me like during the winter in Cleveland now. But other than that, like the rest of the year, it doesn't bother me as much like it used to.
For me, it took a while too, but same here. Like I don't experience swelling all the time and stuff like that. So that we reach there, it takes a long time, I'd say, and also it takes a lot of like energy and effort, and like being very, I guess, like diligent with like your medications and like everything, lifestyle and all that. You see a rheumatologist. You mentioned that.
Yes.
Any other specialists that you see?
So now since being in remission, I only follow up with my rheumatologist yearly. And we kind of just like reevaluate how I'm doing. But prior to this, like when I was diagnosed, I was seeing a rheumatologist, a pulmonologist, I saw a neurologist, I saw occupational therapy. Who else did I see? I saw so many people. Oh my goodness. Yeah. But now after like my treatments and everything, I just follow up with my rheumatologist once a year.
Okay, wow. So prior to what we were talking about in terms of like the different specialists you see, how did it feel kind of like now all of a sudden it's like I have to see 4 specialists plus, and I have to tell them about like everything that's going on, and like what was kind of going on in your mind? I only see a rheumatologist and like a family doctor. And that was like since I was 13. But you've seen so many. So
it was stressful at the time. I mean, it just felt like you were telling your story over and over again. And okay, well, this is why I'm here for this. I mean, it was tiring, definitely. I felt like I always had doctor's appointments. Like in the midst of like being on all my medication, I was seeing my rheumatologist every 6 to 8 weeks, maybe getting blood work done then. And in between those, I was seeing like other specialists and getting tests done that I needed. So, I mean, it was a lot. I'm like, I feel like I'm always at the doctor, but definitely just having to tell your story over and over again is not fun, obviously.
I know.
And like, I feel like it takes a lot out of you.
It does. I'd love to just like copy paste and like send it to like this same one. Like, why don't you repeat myself? But I mean, there's probably benefits out of repeating yourself. I don't know.
Yeah.
Something that other people have not found. So you mentioned you're in remission. What was your medication journey like to kind of achieve remission?
Initially, the first thing I was on was amlodipine, like I mentioned. I was on that for the Raynaud's. I started that, like I said, when I was 15, probably. I still take that now intermittently during the winter when I think I need it. I was taking a proton pump inhibitor. I was on prednisone for a long time. I was on methotrexate for 5 years. I was on, what else? I'd take folic acid with the methotrexate. I was on Plaquenil. It was not fun.
Let's talk about methotrexate because I'm on methotrexate too. So you said you were on it for 5 years. How did your methotrexate journey kind of go? Was it pill, needle? How did that make you feel?
After I got my official diagnosis, when I went to Pittsburgh Children's, she said that she wanted to start me with the injections, just because that would be the quickest way to get it into my system. And she was like, okay, maybe after a year, then we can go to pills. So for a year, I did injections. I came home from Pittsburgh. I had like a nurse teaching appointment. And she's like, okay, we're going to practice giving yourself a shot. Let's practice your first dose right here, which wasn't fun at all because I don't know why. And like, I'm a nurse. I have no problem giving somebody else a shot, but there's some weird, like psychological thing about giving yourself a shot.
Mm-hmm.
I don't know. It's just like, I would sit there like staring at the needle, almost giving myself a shot, then deciding like, no, not yet, for like an hour. Every time it was time to do my shot. It was like hours long of a process of like thinking about doing it, not actually doing it. And I'm like, there's just something weird about giving yourself shots. It like gives me the heebie-jeebies. And then all of the negative effects of it, like it would make me super sick. I would live on Zofran for the next couple of days. I was so nauseous from it. It made like lots of my hair fall out too. So aside from like the psychological part of I'm poking myself with needles and this is bothersome, it's also like, oh, every time I take a shower, I'm like, oh, more and more hair sitting there. So it made my hair really thin, which never grew back too. Fun fact, when you're done with it, your hair doesn't just come back, I guess. So that, and then I was so sick from it. Like I was saying, I had to take Zofran for days after, and I felt like trash. And by the time I was feeling better and feeling myself again, oh, it was time to do another one. So it was like this never ending cycle of like never feeling good.
That is a little bit relatable. I am also on methotrexate, totally can relate with the hair loss. Like I go to the washroom, it's like, there's a whole pile of hair. Don't know where it came from. Probably is mine. But I know a lot of people like to take it on Fridays and they have like the Saturday and Sunday to like not be like feel sick. And
yeah, that's what I would do. Yeah.
Okay. Yeah. I take it on Mondays, not on Fridays.
Yeah.
So I take it on Mondays. I don't do it myself. I'm terrified.
Oh my gosh.
No, thank you. I can't. And I will not let anyone in my house give it to me either. Like I need to go to a doctor. They have to give it to me. Like I can't. I was like, no. And it's really funny because I used to be on it 4 years ago and it didn't work. But I'm on it again with Plaquenil and sulfasalazine and it seems to be working. So, and sometimes it's kind of like the question of like, is it working? Because you're on like 3 other meds. I don't know which one's working. So it's not confusing and I do experience a lot of those side effects. And so very relatable.
I think people don't realize how much it sucks unless you're in it.
Yeah, it's like people just like hear us talking about methotrexate, oh, it's whatever, like hair loss, but you don't understand how it feels like experiencing hair loss till it happens to you.
Yeah, and it's like a teenager and you're like, there's all my hair.
How do you kind of practice self-care?
So as far as like taking an active role in my care, it definitely started when I ended up seeing another doctor and I started asking more questions. Because before I was kind of like, okay, you tell me what to do, I'm going to do it. But when I started seeing someone else who I wasn't as familiar with, I definitely was like asking more questions and I wanted to know like the whys of things and like, okay, but why are we doing this? And like, what options do I have? Like lay it all out for me. Yeah. And I think that was the first time I was like, I guess, brave enough to ask those questions because before I was like, I'm just going to do what I'm told, like they know best. But I just kind of wanted a full picture and I wanted to have a say in what I was doing and what I was putting into my body. Yeah. And then as far as other stuff, I started thinking about like, okay, what can I do to help my joints? Because while the meds like helped a ton with like my skin tightening, they did help with my joints, but like, even like if you look at my hands, I still have like arthritic looking hands, like that's never going away. But I'm like, okay, what can I do to fix this? Because like my grip stinks. So for a while after I'd been in remission, I started going to a CrossFit gym, and that helped my grip strength. I mean, like my overall strength tremendously. I was able to hold on to things longer. I wasn't having like the pain. I mean, after a while, like my hands would get really sore, my joints would kind of hurt. But that helped tremendously with strengthening my joints. And like I owe a lot of my, I don't know, how I am today from that. Because if I wouldn't have done that, I don't know how else I would have on my own thought about, oh, how am I going to fix my grip strength and fix all of these things? But doing like functional fitness and functional movements that are going to help you in everyday life, I mean, that made my joints a billion times better.
Yeah, and that's really good. I think most of the time it's really important to, well, all the time it's important to practice self-care, but most of the time exercises do benefit certain people and their conditions, and like also like eating healthy, mindfulness, practicing that. Like I'm glad that you're able to find what kind of works best for you. It's also a really big step to take an active role in your care. Like it's hard. How did you kind of get to that point where you're like, okay, this is what I have to do. This is how I need to take an active role. Was it challenging for you at first?
It was definitely intimidating too. It's just like to do something different than what you had been doing, you know?
Yeah.
And being confident enough and comfortable enough to be like, okay, I've got to do something. This is what it'll be. We'll see how it goes and go from there. But everything I did helped. I mean, I started following, I read this really good book. Okay. It's called The Autoimmune Solution by Dr. Amy Myers. And she goes through this whole autoimmune protocol that she created and that she prescribes to her patients. And a lot of the stuff in there, as you're reading it, you're like, hey, this is like common sense. I mean, do things to reduce your stress, avoid processed foods. And she basically talks about how when she was in one of the most stressful times of her life, when she was in medical school, she developed an autoimmune disease. And so she wanted to develop a protocol to put someone into remission through like lifestyle changes. Obviously, people need medication too, but all of like the lifestyle steps that she took to help, and she prescribes that to her patients too. So I started kind of following that too, like making sure you're getting adequate sleep, because if your body's under stress because you're tired, your cortisol's through the roof. That's going to increase your inflammation in your body. That's going to make all of your symptoms worse. Same as like food goes. If you're eating like sugar and refined processed foods, all of that is going to create a stress response in your body, which is going to create inflammation, which is going to make your symptoms worse. So I kind of tried doing all of those things too.
That's really good, because I've heard there are a lot of like physicians out there that have autoimmune diseases and are creating kind of the lifestyle change, but then also helping their patients with not only medications, but adding lots of medications like you mentioned, sleep, mindfulness, exercise, and eating healthy, which are really good things to incorporate. Like I know for me, those things have helped as well. So hopefully in the future, a lot of people get into that, because I've seen that just like taking care of yourself is really important. So you have 2 conditions, and on top of that, you are a registered nurse. How long have you been working as a nurse?
So I've been a nurse for four years now. Yeah. Super
what
fun.
What kind of inspired you to go on this career path?
So I was actually very inspired by my rheumatologist that I had when I was a teenager. So I initially started college as a biology pre-med major, and I wanted to be a pediatric rheumatologist. Okay. I was so inspired by her. And so from there, I was taking all those prerequisite classes. And it's not like I wasn't interested in them. Like I get that you have to take them to get to that point. But I was also more worried about like wanting to like take care of people in that aspect, like more hands-on. And I thought nursing might be able to provide me more with what I was looking for. So I changed my major, went to nursing school, and here I am.
Yeah, I think even like same for me. I do aspire to be a physician as well. I definitely see like how nursing can be more hands-on per se. The prerequisites for like pre-med are not the most fun, I'd say. Like sometimes you have to do calculus and physics and also like pressure on your hands as well, right? Because you're also battling an autoimmune disease, and on top of that, it's like I have to worry about school, I have to worry about like social life, I have to worry about like everything. So it's definitely a lot to handle, but I think like if you can handle what you're doing, that's really good. And I'm glad that you're able to realize that you enjoy nursing and this is what you like. What is the most kind of rewarding part of your job? Like, what do you like the best?
Getting to know the people that I take care of. So more recently, I've done all women's health. So obviously as a woman, I think that our bodies are so cool and are capable of so many incredible things. So I like taking care of women. And I just feel like the bond you have with your patients, like getting to know them. I was doing labor and delivery prior. And now I'm working at a fertility clinic. And I think in both places, you were kind of able to like really get to know your patients. Like in labor and delivery, it's like you'd have patients that were coming back to have another baby. And it was like, oh, hey, I remember you. And you remember all these things about them from years before. So it was just special taking care of them again. And then in my current job now, when it's like you see these patients multiple times, you really start to get to know them a little bit, and know their stories. I really like that too. So I'm very passionate about women's health. I think it's awesome. And I think our bodies are capable of so many cool things. And it's really special to be a woman. And like when I see people who would, I mean, like have certain medical conditions and be on certain medicines and talk about stuff like that, I'd be like, I get it. Trust me. Like I understand and I know that it stinks. Especially like being a young woman too, who has medical issues and is on a ton of medications. I feel like other women in those situations, I guess, feel like it's harder to relate to them maybe, because you think of like most young women are totally healthy and normal. And then just meeting other people who kind of have things going on and being like, hey, like, I get you.
It's so interesting to see how when someone has kind of gone through that experience and then they try to like talk to you as well, like the connection that you make, even though it's not the same thing. Like I know like your conditions are not kind of what you work on a daily basis, but just being a patient in that environment, understanding that like what patients go through and then being like, oh, I also understand this. Because usually like when you have a physician who has not gone through the experience, it's even harder to make it feel like you want the care that you need.
Yeah, I get that too. And I think it's very easy for me to also like treat patients or like someone else's family member like how I would want to be treated or how I would want my family to be treated, because then I feel like, okay, I've been on both sides of it, you know?
Yeah. And then also not repeating things that you went through that kind of cause like stress. And I mean, like, I think when those experiences, you're able to like be like, hey, like I did not like when this happened and there is an alternative. So let's go with that alternative. Do you have any additional kind of accommodations in the workplace?
Yeah. I mean, right now I don't feel like I need anything. As I'm feeling like pretty okay. And I don't think in my current role I would really need any type of accommodations, but I can totally see like in other areas of nursing where like someone with arthritis would definitely need a little bit of extra help in some situations for sure.
Thank you so much, Katie, for coming on to Take a Pain Chat today. I really had a great discussion with you. We talked about many things. Some things are relatable, even though our diagnoses are not the same. Like methotrexate, kind of what it feels like to get support, feeling supported, all that fun stuff. Yeah, everyone like, comment, and subscribe. Check out Katie's social media accounts. Bye.